Welcome to MediPocket Podcast, where we bring the stories of resilient survivors and warriors. I'm honored to welcome Mel Man. He is the world's longest living Gleevec and TKI survivor, over 30 years, thriving with chronic myeloid leukemia, CML. He's a retired Army major, an MBA, and a clinical trials OG with true street credentials earned in the fight against cancer. Mel is not only a survivor, but also an advocate, a mentor, and a living testament of perseverance and hope. Mel, welcome to the show.
Pleasure to be here.
At the very beginning, what were the first symptoms or signs that let you get checked, and how did you eventually receive the diagnosis of CML?
My symptoms happened kind of slowly over time. They started in 1994, and it started with my back hurting, and it started hurting so badly that I went to the doctor, and the doctor tried different things like physical therapy, traction, pills, and so forth. And then it just kept hurting. And then the doctor ordered an MRI. And from the MRI, I got those results back in January 1995 after the the holidays during that period. So, as she was reading the MRI, she noticed that it said that my bone marrow was not the normal bone marrow for someone my age. And that kind of sets alarm in her mind that it may be some type of blood disease. So what she did was she had her technician come in and take a blood test, and he went back out and did the the count and came back in, and he said my blood count was 140,000 when it should have my white blood count, and when it should have been under 10,000. So she pretty much felt that it was leukemia, but she didn't know what type. And she was a primary care doctor. So I was in the military at the time. So she sent me down to a specialist, which was like 3 hours away because I had to stay in the military system. So that was I was living in Michigan at the time, and she sent me down to Dayton, Ohio from Detroit, Michigan. And that was the next day I saw the specialist who did more tests and pretty much confirmed. He took more blood. He took a bone marrow biopsy, a bone marrow aspiration. He looked under the microscope, and he saw that my cells resembled CML cells, but he said we have to wait till the final result to come back from the test he has to send away to confirm it. But he was pretty sure it was CML. So that was how I was diagnosed, and it was a shock.
And how old were you at that time? I mean, you look pretty young right now.
So much. I was 37 years old, and I was up in, like I said, Detroit stationed in the military with my wife and our 5-year-old daughter. And so, my first thoughts were about my daughter, who was 5, and because he went on with the diagnosis because he gave me the prognosis. He said, well, it's going to be, the prognosis is 3 years, and we don't know exactly where you're at. You could be less or it could be more, but it's like 3 years. And the only possible cure is a bone marrow transplant. And at the time, bone marrow transplants were relatively new, and the list was very small. And so if no one matched me in my family, then I would have to look on the registry. And there were like less than 1 million people on the registry, where there's probably maybe about 25, 26 million people on the registry today. But back then, that was they were still building up the list. And long story short, my sister, I had one sibling, and she did not match me. And looking on the, and very slim. Uh, well, long-term survival was impossible without the bone marrow transplant.
It's definitely, I mean, you were a young lad at that time with a young family. When
Mm.
you first heard the word you have CML, obviously it might not be very clear what does that even mean, right? I mean, that's a heavy medical term, but I think leukemia already is a word that gets you the understanding what is that, or, what went through your mind and how did you and your family process those early days?
What happened was, um, when I first heard the word leukemia, it was from the doctor who was up in Michigan, the primary care doctor, and she was like very positive because she really did not know exactly. She had said, with leukemia, the chances are fairly good for survival, but she was actually thinking about childhood leukemia at that time, which had made a lot of progress. But as for CML in adults, it was a different story when I went down to see the doctor, the specialist, the oncologist, and he laid it out very clearly. And I went into like shock because it was like, and I really didn't know what shock was until he told me. And I said, well, this is what shock feels like. And I couldn't like hear everything he was saying because I was still trying to process things as they were coming in. And I was sitting on the couch and he was at his desk. So and I was a little bit lower than he was. So it was like the words were like flowing down, but I didn't catch them all because when he told me, start telling me the information about 3 years, I'm thinking about my daughter. And this is the first time where I actually thought about, having a date with death. You've got your time now, and it just came like out so quickly. And I remember I heard this big drumming sound, like boom, boom, boom. And I looked up on the wall. It was the clock. It was the second hand just ticking. But I guess my senses became so aware of the different stuff that that's what I heard. And then I heard other stuff coming from him, and I'm trying to process, and I'm thinking about how I'm gonna tell my wife. She kind of knew that what it might be when I went home and told her I was going down to Ohio, but to have that diagnosis, it was, how will I tell my mother, all these different things. And then he starts saying like a bone marrow transplant. I didn't know what that was. And I was just thinking about these big machines, how do they transplant marrow, all this stuff, so it was like mind boggling. And then, he was just saying all this, I mean, it was just overwhelming. And I remember, when I walked out of the hospital, it was like my back had stopped hurting because my mind was so focused on that diagnosis. And then I was like, these cars are still going up and down the street, they're not stopping for me, but I'm still like shocked looking around. And um it was very overwhelming for that in that situation.
No, we can imagine that. I mean, as you said, you don't realize what shock is unless you are in that position. And you said that your wife had an idea what's going on.
Yeah.
She was very young, 5. Did you decide to tell her, or would she came to
Oh,
know eventually?
yeah. So what happened was, being in the military, the first doctor, the PCP doctor, she called the doctor in Dayton, Ohio, and he said for me to come down ASAP and be prepared to stay 3 days or 30 days because he didn't know exactly what type it was going to be. So in the military, you just can't go anywhere without telling anybody for 3 days or 30 days. So I had to go home and tell my wife. I had to pack, and she was in shock. And I sat down on the couch, and she was like, "Well, what's wrong with you?" And so I told her what happened, and then I had to go tell my boss. I had to drive in and tell him because I was going to be gone. I didn't know how long. And, he said the same thing. I sat on his couch and he was like, what's wrong with you? And so I told him. And then I went down to Dayton. And the next day I saw the doctor. And the only other person that I saw in the office, like, was his kid. He was from Kentucky, from Fort Knox, and he had been diagnosed with leukemia like a couple weeks before, and this was back before you could like check the internet and get symptoms and get your prognosis or anything. So I had no knowledge of, I could not research it, and I went by the library the night before, and there was like one book on leukemia, and it was from 1908. But I checked it out anyway, and that didn't help either. And so I was talking to this kid, and he starts talking about the needle that they do the aspiration with, and I didn't even know that they were going to do that. So he just like he talked about it for 15 minutes. So I know that was a mistake to ask him about leukemia, but I did. So when I went in to see the doctor, I asked if I could see the needle. He had everything laid out, and he had that big old needle there. So that's how it all started. And I sat there, and he asked me, "Did you want anything for this? Do you want something to calm your nerves?" And I said no, because I didn't know what was going on. I didn't know if I was going to be driving back that day, or if I was staying or whatever. So I didn't want to take anything. And I just kind of like meditated while he did the procedure. He like numbed the area and everything. But that's how it started.
A lot of unknowns, and I think the anxiety increases when you really are not very clear about what's going to happen next. I think, and that happens with the patients and caregivers all the time in conditions like this, because I think it's more anxiety of uncertainty and
Mhm.
not knowing, how the things. And that is something I always feel like somehow a healthcare system, by now we are so advanced and we have a knowledge about, the pre-procedure, during procedure and post-procedure. Everything is so well defined now. How
Mhm.
about we provide that to the caregivers and patients at least 24 4 hours before, so they can be a little bit well equipped with the knowledge what to accept, and expect also at the same time, so they don't come like, lost and like asking other patients like what would happen now. I mean, and back then, as you said, obviously the information was limited, the treatment options were limited, and outcomes were uncertain. So what was your initial treatment journey like, before Gleevec, as you mentioned in your stories? What were the biggest medical and emotional challenges in those early days?
Well, what he did was the doctor, the oncologist, started me on Hydrea to get the counts down. And meanwhile, I had told him that I wanted a second opinion because I still could not, I still was in denial. So they flew me up to Walter Reed Medical Center, and the doctors did the same test. He took my blood and looked under the microscope, and he came back with the same conclusion. And so at that point, we started interferon, and that was like an injection in my stomach or my thigh every day. And so that caused like flu-like symptoms. I started losing weight. Um, Sometimes I would get like a little like infection at times, but uh, and it caused fatigue and so forth. So I started on that. But the first couple of weeks, once they told me that I needed a bone marrow um, donor, and then I found out my sister did not match, and then checked the registry. What I did was I went to the different agencies, bone marrow agencies, and told them that I wanted to do my own bone marrow drives. And they said, well, nobody has ever found their own bone marrow donor. So we suggest that you let us, take care of all that, do the drives and this and that. But I figured that it would be better for me to get involved and see what I could do, and perhaps um, have more empathy and connect with the people better. And so I started doing a bunch of bone marrow drives. And the people at work, they all my coworkers, they stuck their arm out and gave blood. So what happened back in those days, it was not just a cheek swab, and they had to actually give like a couple of tablespoons of blood to see if there would be a match. So I had like 350 of my coworkers do that, and then I started doing drives in the city and in churches and colleges, and then the military would fly me around to different cities and military bases, and I started doing drives there, and it was very successful. Thousands and thousands of people.
Wow.
Mm-hmm. I never found a match. Could never find a match. Um, what happened after that is that because I was diagnosed with, and they called it terminal leukemia, and that was in my record. He has terminal leukemia with no hope for um, um, survival without the transplant. And they didn't do transplants when you were active duty, so you had to leave. The military. I retired, took a military retirement, and I moved down to Atlanta, Georgia, which is where I'm at now, Atlanta, Georgia. And I've been here about 30 years. Oh, yeah, over 30 years now. And I started doing drives down here. And I had other people doing drives for me too. People do drives in different cities. And my aunt, she did like 4 drives, and she did a drive in Columbus. The 4th drive was about a year and a half into my diagnosis of 3 years. So I went down to that drive, and when I arrived there, everybody was saying, well, there's this guy, was Mark, who's a well-known businessman. And they said, well, Mark was here, and he was looking for you. And I didn't know Mark, but everybody else knew him. I think he owned a couple of car dealerships and stuff down there. And so I hung around there, and then he came back, and he said he had hairy cell leukemia, and he had run out to MD Anderson in Texas, and they did experimental stuff on him. He was like near death, and he was able to go into complete remission, and he was looking good, and looking very healthy. And he said, well, this is what I recommend you do. You do the same thing too, because these bone marrow drives are great. You're saving lives, but cancer is a very fast moving illness. One cell becomes 2, 2 becomes 4, and so on. But you need to do this, look into this, and look into it ASAP. And he gave me the information to his doctor. And when I got back to Atlanta, I called the doctor. The doctor picked up the phone. The nurse picked up the phone. The only time they did that in like 20 years. I can never get call that same number, but they never picked up again. But I called them that time. They picked up, and I was able to talk to them for like maybe 10 or 15 minutes and tell them what was going on. And they said, well, come on out. And I went out within the next few days, and the doctor out there, he pulled up my records. Part of them, most of those were like paper records and whatever. And he was looking at them, and he said, well, we still have time. And I didn't know what he meant by that, because to me, the diagnosis is a diagnosis. And he says, I'm going to increase your dose of interferon, and I'm going to put you on clinical trial after clinical trial. And so that's what we started doing. And the reason why it was important that I see that doctor is that doctor was the doctor who did the clinical trials on interferon for CML, which was the standard care at the time. So I was really seeing the best doctor in the world for CML at that time. At least I felt that. I mean, there's others at that same level, but he was at that level, um, and so you know that's how it started with the clinical trials.
Back then also, which is 30 years back, you did something which in the modern uh, era we are advocating a lot, which is second opinion. So
Yes,
people, especially when it's this life changing diagnosis come to your way, do not settle with one first option or the first advice. Always seek second opinion. And it's not just because of the denial, I believe. It's also, it opens up more options. The clinical trial options came to you by someone who went through it. But sometimes when you take a second opinion with another doctor, they might have a experience or awareness of something new that is getting into the trials or is in the later stages of the trial, more advanced. But that will only happen if you open the window to look for second opinion.
yes,
And that is so inspiring, that what we are advocating 30 years right now about second opinion, that's part of it. My company is like, we help patients before you get into any treatment. Doesn't matter what part of the world you are, what part of the region you are in United States, do take second opinion before you get into any major treatments. And I think that is where your journey with the clinical trials began. And back then, I think the clinical trials were very, very less understood as compared to what they are now. You becoming part of clinical trials, that changed everything.
yes.
What gave you the courage to say yes to something so new and unknown?
Well, yeah, I trusted the doctor. I trusted the facility, and I knew that without a bone marrow transplant, that I would probably be dead in a few years. Barring a miracle. And so I knew something new had to happen, and the only thing new that could happen would have to come from research. It would have to come from a new drug. So I understood that, and I thought drugs came faster than they did, but drugs at that time came very slowly. In fact, for CML, over like the past 40 or 50 years before that, only like 3 or 4 drugs and therapies had been developed. So I didn't know what was coming down the line, or what would, because really, when I was diagnosed and they told me 3 years, I was just bargaining. My bargain was for maybe I can get 5 years, or maybe I can get 10 years. Maybe I can see my daughter grow up to be 15 or whatever, instead of 8. So, and at no time did I think a drug would come along and keep me alive forever. That's like, you know, that's not even a possibility. But I wanted to be around as long as I could. So, and the clinical trials offered the only possibility, and so that's why I was on board. And I believed in research. I worked in research and development in the military. It was for something different, but I knew that for like anything, it's going to take 10 to 20 years for it to happen. But you have to start, and eventually those things start appearing. And hopefully, I thought like this whatever this drug was going to pop up, and so I was that's what I felt was my best possibility, my best chance.
Came from your research background again, the quick decision making, because you understood the process. Because a lot of time people feel clinical trials, if you go for it, you were going to be treated as a guinea pig,
Uh-huh.
which is not the truth necessarily, because the human trials begin at a very phase 4. And a lot of people don't understand that you are not being a guinea pig when you get a part of these clinical trials. It
Yes.
actually gives you more hope, which
Hmm.
a treatment might be limited and restricted in it. It gives you more possibility, either increasing the number of years or increasing the quality of life. Clinical trials. And another thing, I think back then, obviously, everything took longer because, it has to be done in a traditional way. Currently, with technology now, especially with the use of this AI in many healthcare fields and medicine, the development of any new treatment, especially clinical trials, going through the phases faster because of the amount of data that can be processed, efficiently and faster. The timeline for new treatments and drugs to come out have reduced to half, if not one fourth. And hopefully, down the line, it could be reduced to one fourth, and we can bring the faster the cures to the market. And we saw that during COVID. Obviously, it couldn't get to the full length of the trial, the vaccines, but still, and like in the very span of, like, I think it was like 12 months that we were able to bring the vaccine, or less than 12 months, the vaccines were there. So that definitely, the technology is shortening that time, but still, clinical trials are less understood field. Let's talk about your Army career. Now, you are a retired Army major.
Yes.
How did your military discipline, and the mindset help you face the battle of cancer treatment and uncertainty? Do you think you faced it differently if you because of that, or if you would have not been in military, it would have been a little different, challenging? Walk us through that.
Did help. And some of the ways that it helped was that, you do a lot of planning in the military. You plan ahead, and also you plan backwards. And so I did both of those. I did the backwards planning, and the military sets you up for that. You got 3 years to live. So when I started our process, and they made sure that everything was taken care of, financially, medically, and I chose where I wanted to be in 3 years, which where my family wanted to be in case something happened to me, and that was down here in Atlanta, because my wife is from around this area. I'm from way up in Ohio, but in 3 years, if I'm not going to be here, it'd be better for her to be closer to her family. So it's all like backwards planning. You're planning for the worst, and you're planning for the best. So you got two things going on in your mind, but that's what you plan. You plan for all outcomes. So that was part of the military. Another part that helped me in my background was I was a long distance runner in high school and in middle school and high school. So I went like up to a marathon, and so it's endurance, it's stamina, because cancer is not a quick journey. It's a long journey, and it's working through pain. Running long distance can be painful. You have to run through the pain, get a second win. So that's the mindset that I had. And I remember one time I was being what they call phoresed, when they take blood out of one arm and take it, clean it up and put it back in your other arm. And it took about 3 hours. But I knew I could do that because that's about how long it took me to run a marathon. So I just, sat there for 3 hours like I was still on a marathon. And so that mindset of being a distance runner helped in that aspect, and you have to endure a little discomfort, but you can make it through. And so the Army mindset, the distance running mindset, the athlete warrior, that type of mindset did help.
It's always like you get prepared ahead of time, which is, I think, it's sometimes the God's plan how you are, with the military, with your athletic background. I think all that, it's not that God, I always say, it's all written, right, for us. And God prepares us, knowing us to what's coming. And I think listening your journey, it's like he was preparing you that you need to be strong because what's coming, so you can endure it better. And that's what you displayed for you. And you were talking about in the last question that you were bargaining 5 years or 10 years or 15 years. And now I bet you might have grandkids running around and you're still.
Yeah, I no grandkids yet, but I know what you mean. I'm at that age now, because when I was diagnosed, I was 37, and now I'm 68. So It's been a long time. I never thought I would be 68, and I was I kind of joked that aging is now the side effect of Gleevec, because because you live a long time now, so you grow old, so that's a side effect. Um, uh, um, yeah, it's hard to believe now, because. Um, it's going to be 31 years. It's probably actually 31 years since I've had the disease, but officially diagnosed with it, it'll be 31 in January. And pretty soon, I'll be as old as I've lived as many years as I was when I was diagnosed, which is, really, really something, you know.
Yeah,
Hmm.
looking back, I think you can really see, like, how you literally, as you're saying, you lived equal when it is when you were diagnosed. And I think it's the mindset.
Hmm.
People have given because of the first prognosis that you got, but you keep, again, the military, and you're athlete, you keep fighting, you keep enduring. Is like, I would not stop until it's a stop.
And it's also adherence, because part of the thing initially when you're on what they call these TKIs and this therapy is taking your medication. So I've been consistent with taking it. And some folks, they say, oh, I'm doing well, whatever, and may not take it as consistently. But in the beginning stages, it's important to take it. Eventually 20% of the people are able to stop taking the medication, but initially to get down to where you need to be, it's important to take it.
So,
So
it's a long time, as to taking the medication. And were there any kind of side effects or challenges you faced, and while being so long on such medications, and how did you adapt yourself, your lifestyle, to manage them while still living fully with all the things that you do actively?
the side effects, it was like a low level fatigue. It doesn't really affect me, because it's not very low, but it's low. And being a distance runner, I kind of was used to being, driving on when I'm not like 100%. And by that I meant when I ran a marathon. I think I ran the second. Well, I ran a second one since that. I noticed that I was not at the top, whatever that I could have been, but I still was able to do it. So it's not. I was still able to perform. Uh, Now everybody is not in the same category. It affects everybody differently. Another thing, I had puffy eyes and like skin discoloration, something called melasma, and but those things were minor to me. If you were told that you were going to die and you're still here so many years later, um, it's not the same as someone who's diagnosed these days. And I can understand that, because any diagnosis is terrible. And so they can compare themselves with me, because I'm thinking a different way. I'm thinking like, I could have been dead or whatever, but now it's 30 years later, and they don't have the same, they're not going to sell it for that, because they've seen how the progress of these different drugs, and they're hoping for a cure, and that is possible with research, that the cure will happen pretty soon. And the reason I say that is that there have been 3 different generations of TKIs for CML. It was the first one I started with, and then there's like been 6 different drugs that have been approved, and all of these drugs have been approved. They've been accelerated approval. Like for example, Gleevec was approved in 3 years. Uh, I started in 1998 on the drug. It was approved in 2001, and normally it would have took like 10 years to approve it, but it was shown that so many people were living and surviving, and that there was a cytogenetic and it was down to the deepest levels of change that people were saying, I want that drug, I want that drug. And so it was a accelerated approval. It saved a million lives. So that's the testimony right there. And it works for 11 different cancers.
Talking about, were there moments when you thought you might not make it? And if so, how did you push through those lows?
That I didn't think I was going to make it was when I was getting to the 3 years and beyond before I got to Gleevec. So those 3 years and beyond, like 3 years and 6 months, there was a period there I didn't think I was going to make it. It's gotten like really skinny, and it was hard for me to walk around the block, without getting winded. So um, it was during that period that because I had asked the doctor at the beginning of that 3 years, because at the beginning of the 3 years it was like, okay, I'm at that time when they said I'm gonna die. Okay. And I asked him if there were any more drugs. And he said, well, we got one more drug, but it's still in the lab and we're having problems with the animals. And I kind of knew that this drug was coming, but still I wanted to ask about it. And he said, well, if we ever get approval to use it in humans, you'll be the first person to use it. And his nurse was there at the same time, the same nurse that picked up the phone. He was like, you just told the other guy that same thing. And then he said, well, okay, you'll be number two. So I went back home, and during that period is when I started having doubts, because it didn't seem like it was going to happen in time. And then he called me like maybe 6 months later and said they got approval to use it, which was the Gleevec. So I came back out to MD Anderson and started taking the Gleevec, and it started working. I started on a very low dose, and eventually they increased it, and then increased it again. And then 10 months later, I ran a 26.2-mile marathon in Anchorage, Alaska. So, but I still didn't think that that was going to be, how long I was going to live. I knew that it was good, but I didn't know if it was going to be good for 10 years, 10 years. But I never thought that a pill is going to keep me alive for like 30 years, because it talked about the bone marrow transplant being the cure, which was a lot different than the pill, because it was like you have a 50% chance of surviving the bone marrow transplant. So that was one of my fears. And but as time went on, they start saying, well, people gonna have a normal lifespan. But that was like maybe about 8 years later when they started saying that, and I started believing it at about maybe about 12 years later. It took me a while to really accept that I could live that long, even though things were happening underneath, in the marrow and blood and going back to normal. It still was like, how long will it last?
I mean, it's definitely a marathon. So
Yeah.
as you said, it's like, but endurance is like, I won't stop until I stop, or there's a finish line. And I think that's where your 5 to 10 to 15 to 30, and we wish you it goes more. Really, for someone listening who's just been diagnosed with CML or another or any serious illness, what message of hope or practical advice would you want them to take away from your journey?
For someone who has just been diagnosed with a serious illness, is that I would tell them, first of all, get as much information that you can about your illness. Study your illness, and also you have to get a support team if you can. Keep your family informed. Your wife, whoever you think is going to be your caregivers, because your caregivers are just as important because they may have to travel. They may have to think about, how can I make this work? Also, not just you, but your caregivers too. And you go get a second opinion. Second opinions are very important. You're not going to offend the doctor by saying, "Can I have a second opinion?" I told my doctors, and I liked them very much, but I wanted to get a second opinion. And then I got my second opinion, went back to them, and did the treatment. And then I moved down to Atlanta, and and then I started with the clinical trials. But second opinion is very important because different centers have different ways of thinking. So it's important to explore all your options. And I will also tell them to also get with an agency that kind of knows about the disease, one of the nonprofit agencies. For example, with me, it would be a blood cancer agency, Leukemia Lymphoma Society, Blood Cancer United. It would be them because they have support groups, they have financial, aid and stuff like that, and help with travel and different things. So those things. And then my advice would be, eat as healthy as you can, and still exercise if you can. Do the things that you bring you good health. Meditate, pray, do as much of your normal life as you can. So keep your head up. Don't feel ashamed or whatever because you're sick. I know a lot of times you can't tell folks because of your job, might discriminate against you or whatever. But keep your head up and be as positive as you can.
Very powerful, and keep yourself as normal. Obviously, the second opinion you pointed is very important. You do not offend anyone, which again is a very big kind of hesitation of patients. Am I going to offend the doctor? And this is the good doctor who's going to treat me. I don't want to offend him. But that's not the case. If the doctors are there to help you too, and they're open-minded, and regardless, you have to take your options because it's your life.
Right. The doctor's going to get second opinions when they get sick. So you might as well go get your.
Absolutely, very rightly said. Doctors will do for themselves. They will do for their family members also, right? They go out and take second opinions, and they do the peer-to-peer review of the things, which is equals to second opinion. So as a patient, as a caregiver, you should always go for more options, at least find out. And another thing you said, especially now available in this modern times, a lot of information is available. So educate yourself. Don't treat yourself, but educate yourself so that when you are there, you're aware what next or what could happen.
You have to be careful about what advice you listen to, because I've heard a lot through the years. So when I was first diagnosed, people were like, "Have you heard about the banana diet?" Banana diet. So you just have to be, sort some of that stuff out, because people throw a lot of stuff at you, So
learn, but don't apply until the expert tells you to do it. Thank you so much, Mel, for sharing your journey with such honesty and strength. Your story is a blend of medical innovations, human resilience, and the power of saying yes to hope, even when the odds are stacked against you. You have not only survived, but created a roadmap of courage for millions. And thank you so much for coming to our podcast.
Been a pleasure, and it's always a joy to share my story and in hopes that it may help someone. But thanks for having me.